So, welcome to the New Mexico Family Advocacy Program's second 2020 ECHO presentation. NMFAP is a model of respondent parent representation being implemented in the 13th and 2nd judicial districts that utilizes interdisciplinary teams of lawyers, social workers, and parent mentors working effectively together to provide quality representation and the advocacy and support families need for reunification or other preferred outcomes in the child welfare system. As participants in our community of practice, you will receive professional development from experts and early adopters of the NMFAP model, learn best practices, and collaborate to solve issues that present challenges to providing quality parent representation in the court system. So we're all working remotely today, but I will be facilitating. I'm Leslie Jones. I'm one of the lead attorneys for the program. We have a couple of other leads here if they want to introduce themselves.
I'm Caitlin DeFior. I'm the lead social worker for the program.
I'm Quiva Hubbard. I'm the parent mentor coordinator for the program.
Thanks.
This is Andrea Gunderson. I'm the other lead attorney for the program.
Great, welcome, Andrea. And a reminder, we've got Jen there. Jen, you want to talk about tech support?
Hi, Jennifer at AOC. I'll be providing tech support as I usually do, and I'll be getting the link up for the, I'm sorry, that's Leslie, but Leslie usually says. But I'll be getting the link up for the survey. And just
That's fine, sure. So Jen is going to be putting that link up in the chat box. Please remember to complete the post-session feedback and reflection form that link will take you to. Funding for our professional learning through NMFAP ECHO comes from a federal grant. So these surveys are very important to the program's broader evaluation and continued funding. I also just want to remind everybody to please enter your name and your role in the Zoom chat so that we can keep track of everyone who's here today. I also want to remind the practitioners who are present, practitioners in the NMFAP program, to please sign up. Would really encourage you to sign up to present a case or issue for our next problem solving or issue processing session on April 7th. Our session announcements contain the links to those forms. You can complete them and return them to Jen at echonmfap@gmail.com. Okay, so going into our presentation today, the workshop today is CYFD, and I lengthen this out because not everybody knows all the acronyms. Child and Family Services Review and Program Improvement Plan Progress. Our workshop today is presented by Angela Baca, CYFD Quality Assurance Manager, and Sarah Meadows, CYFD Research, Assessment, and Data Bureau Chief. Angela started her career in child welfare in 2001, working with children and youth at residential treatment centers, Namaste and Children's Treatment Center, and as a licensed treatment foster parent for both Namaste and La Familia. In 2007, Ms. Baca started working for the Children, Youth, and Families Department as an investigator. She promoted to a senior investigator in 2010 and again promoted to investigation supervisor in 2016. Ms. Baca is a 2016 graduate of the New Mexico CYFD STEP program, and throughout her STEP journey was an avid public speaker. Ms. Baca joined CYFD's Quality Assurance Unit in January of 2017. Prior to joining the unit, Ms. Baca completed the QA peer review training and participated with the Quality Assurance Unit as a peer reviewer in Valencia, McKinley, and Eddy counties. Ms. Baca is also a contracted CFSR reviewer for other states through JBS International and participated as a CFSR reviewer in Mississippi in 2018. She then promoted to the CYFD's Quality Assurance Manager in March 2019, where she continues to travel around the beautiful state of New Mexico with her team of 5 reviewers to conduct CFSR reviews in each county as part of CYFD's continuous quality improvement. Sarah Meadows, MSW, is the Research Assessment and Data Bureau Chief for New Mexico CYFD Protective Services. She was a data analyst and manager before that and also worked for several years in the field, primarily in investigations, but also in in-home services, and due to staff shortages, carried numerous permanency cases. She teaches part-time for the New Mexico Highlands University Social Work Program, doing research and policy courses at both the bachelor's and master's levels. Her academic and professional interests are related to child welfare workforce retention, continuous quality improvement, training, and solution-focused human services technology. So now I'm going to turn the session over to them for their presentation.
All right, this is Angela Baca. I'm going to go ahead and share my screen with y'all. Okay, is everybody able to see that?
Yes.
All right. So really today what we wanted to do is go ahead and give you guys a little bit of information about the Child and Family Services Review, how CYFD does quality assurance reviews throughout the state, and a little bit on where we're at with our program improvement plan progress. And let's see if my computer will go. All right. So some of the learning objectives. At the end of the presentation, pretty much you're going to leave here knowing the purpose and the framework of the Child and Family Services Review, CYFD's quality assurance process, and also CYFD's progress on the PIP for 2019 and through the 5 rolling periods that we have, which I'll explain a little bit more as we get going. So really the framework and purpose of the Child and Family Services Reviews are just periodic reviews of state child welfare systems, really looking at 3 main goals: ensuring that there's conformity with federal child welfare requirements, determining what is actually happening to children and families as they engage in child welfare services, and assisting states in helping children and families achieve positive outcomes. After the feds kind of come in and do the Child and Family Services Review, once it's complete, states then develop a program improvement plan to address the areas that definitely showed that they needed improvement in. As far as CYFD's program improvement plan, we have been working on this pretty much since after our federal review in 2015. Some of the issues we had challenges in were safety outcomes 1 and 2, which you'll learn a little bit more about, permanency outcomes 1 and 2, and well-being outcomes 1 and 3. So we were really only in conformity for well-being outcome 2, which is educational needs. We also had to look at some systemic factors that were not in substantial conformity, which had to do with our statewide information system, our case review system, staff and provider training, service array and resource development, and also foster and adoptive parent licensing, recruitment, and retention. So some of the things that we have done in order to improve our program, we came up with some teaming, our Pull Together campaign. We have implemented safety organized practice. We do have a new safety assessment and risk assessment tool through NCCD, virtual desktop for law enforcement, working with counties and providing warm handoffs for services, really focusing on worker-parent visits, looking at targeted case supervision, implementing results-oriented management and steps, some of our RAD Bureau programs that we have to really just push our continuous quality improvement. We've looked at foster parent initiatives, doing RAF, navigators, relative placement, genograms, looking at our access to services, regarding our behavioral health division, wraparound services, and also our information systems. So this is something that we've kind of just continued rolling on as we get through our current program improvement plan. So as far as the Child and Family Services Review, there are 3 main components. First is a focus on safety. The second does have to do with permanency of children, and then also well-being needs for children and families that we work with. These are reflected in the 18 items that we as quality assurance reviewers go out to each individual county and really look at how we're rating in those 18 items. So what happens during a QA review with us? We identify the cases that are to be reviewed. Basically, that process is looking at a definitive period under review, which is typically a year. And once those cases are pulled, we do randomize them and go through criteria to make sure that they meet the federal requirements that we have set up with the feds. And then from there, they get assigned to my QA specialist. From there, we look at scheduling case-related stakeholder interviews. We do interview biological parents, children, foster and adoptive parents, caseworkers, and service providers. We also do a review of the hard file and also our fact entries, which is where we keep most of our data. Throughout the QA week, we conduct staffings on the individual cases. That way we can kind of provide feedback to the county staff on things that we're seeing as strengths and also as areas needing improvement. Following that, we conduct a roll-up meeting in order to discuss the strengths and areas needing improvement and trends. This would include more staff, so that way senior workers, supervisors, county office managers kind of all get a feel for what we saw during the week-long review. We then review the preliminary CFSR results with the county staff and also invite stakeholders to those meetings. The reviews then go through a first level QA and also a second level QA with our contracted QA consultant. And that way we're really having that inter-rater reliability and making sure that, that the reviewers are rating everything the same, that there's, you know, we're just following all of those rules. If the site that we review is a program improvement plan site, the Children's Bureau, the feds actually assign themselves cases for a final review. We then finalize the cases and send final case ratings, as well as the tool that we complete to the county, so that way they can work on creating a county improvement plan to improve practice. So for 2019, we did enter the year on a program improvement plan for the following items. Item 2 is about services to the family to protect children in the home and prevent removal or re-entry into foster care. Also for item 5, which is establishing the permanency goal for the child, making sure that it is appropriate, it was established timely. And for item 5, we also look at if we were filing motions to TPR timely. So we do look at that 15 of 22 months. For item 6, we are on the PIP for not achieving reunification, guardianship, adoption, or other planned permanent living arrangement. Item 12 is about assessing and providing for the needs of the child, parents, and foster parents. Item 14 has to do with caseworker visits with child, which includes frequency and quality of visits. And then we are also on a program improvement plan for item 15, which is caseworker visits with the parents, again, having to do with both frequency and quality of those visits. So on November 7th of 2019, the Children's Bureau did report that we met our program improvement plan goals for items 14 and 15. So our goal was 85, and we were able to pass with an 86.1 for 14. And then for the visits with the parents, item 15, our goal was 63, and we did pass with a 68. So we did meet the minimum applicable numbers of cases that we needed. And we were pretty excited to be able to exit those 2 items. So now, looking at our regular PIP sites, our regular review happens between April 2019 and September 2019. The counties that we look at include Bernalillo, Doña Ana, San Juan, San Miguel, Sandoval, and Chavez County. So of those counties, we collect the data from April to September. And in looking at the progress of each of these PIP items that we are still struggling with, you can see that in April to September of 2019, our PIP goal is 71.5%, and we were only at 67.5%. Note in the yellow, we also did not have enough applicable cases during this period. So something that would make item 2 applicable for us would be that we actually had safety issues during the period under review that we were looking at. And for some reason, we still at CYFD have a lot of backlogged cases. And so if any of the cases pulled for the sample had to do with maybe kids who entered care 3 or 4 years prior, most of the time item 2 is not applicable because we didn't have any investigations during that period under review or any safety issues. So we noticed that that was an issue, and you're going to see throughout the presentation that this was kind of an issue for us for several rolling periods. So for item 5, which is the permanency goal for the child for our PIP sites, April through September, our goal is 82.8, and we are definitely struggling at 69.6. For item 6, which is achieving those goals of reunification, guardianship, adoption, or other planned permanent living arrangement, our goal is 49.9, and we were looking at 39.58 during those 6 months. For item 12, which is the needs and services of the children, parents, and foster parents, we were pretty close in this one. The PIP goal is 57.2, and we were at 55.6. For those of you maybe not as familiar with the tool, item 12 hits on all 3 of those areas. So it's broken down into 12A, which is the needs and services to the child, 12B, which is the needs and services to parents, and then 12C, which is the needs and services to foster parents. If any one of those becomes an area needing improvement during the review, that entire item is taken down. So this is definitely a difficult one for us to achieve, and so we were slightly below our PIP goal. So what happened then, the Fed saw that we were definitely struggling. We were not meeting all of our goals during that 6-month period. So what they went ahead and did is worked with us on creating a plan to be able to have a rolling period where we could still look at cases for another 6 months and maybe try to really improve our numbers. So then the first rolling period we're looking at has to do with then the May 2019 review through the October 2019 review. So during that time for item 2, we again did not have enough applicable cases. So even if we had enough applicable cases and met the PIP goal, if we did not have enough applicable cases but did meet the PIP goal, it's not going to count. So here we were at 71.5 and we were still below it at 67.5. For item 5, definitely low. Our PIP goal is 82.8 and we're still struggling at 67.4. For item 6, our PIP goal is 49.9, and during this time period, we were at 45.83. And then for item 12, we were at 57.2 as the PIP goal, and we were at 54.2. So pretty close in some of these items. Still not getting out of any of those. The second rolling period we look at is from June then of 2019 until November of 2019. For item 2, again, still struggling with that applicable cases. So at this point in time, the Children's Bureau did have a discussion with us and let us basically take our sample of cases we would normally have. Half of the sample would remain, whatever those cases were, but from that point on, we were allowed to go ahead and kind of drop cases that didn't meet that item 2 applicability. So that way we would have enough cases to rate that would hopefully help us meet our goal. But at this point in time, June to November, we still didn't have those cases, and we were still below the PIP goal of 71.5 at a 64.10. For item 5, again, we're getting a little bit better, moving those numbers up from 71.7 this time, but still below that 82.8% goal. And for 6, we're definitely getting closer to that PIP goal. We were at 47.9, so just below at 2%. And then for item 12, again, we were getting closer to hitting that item 12. We were at 56.9, so just below that 57.2% goal. So the third rolling period that we're going to go ahead and look at is from July of 2019 to December of 2019. Because we were able to change the selection of cases, we did have enough applicable cases for item 2, but as you can see, we still are below the PIP goal. Pretty significant here at this point. 58.1, and we need to be at 71.5. For item 5, again, still below the PIP goal of 82.8 at a 73.3. Item 6, again, below just under 2%, 47.92, and we really want to be at that 49.9. And for item 12, 57.2 is that goal, and we were still behind at 54.17. So in looking at the fourth roll-in period, which is August 2019 to January of 2020, item 2, we still had enough applicable cases again, so that really did help us. However, we are below that PIP goal of 71.5, and we were only at a 63.64. For item 5, again, still below at 77.78, and we need to be at 82.8. For item 6, we actually met the goal during this point in time. So it is just 0.1% higher than that PIP goal, but we're definitely excited to see that we're going to be exiting item 6. And we were also able to meet item 12 in this rolling period. So that PIP goal of 57.2, we did exceed it at 58.33. So that fourth rolling period did help us to exit 2 more of those PIP items. So as of today, we're currently on a PIP for still item 2 and for item 5. So right now, the 5th rolling period is where we're currently at, and the data has not yet been finalized on this, but we're looking at item 2. We're still struggling with those services to protect children and prevent removal or reentry into care. 60.98, and we need to be at 71.5. And then for item 5, again, getting a little bit closer, PIP goal 82.8, and we're at 80.56. So our last opportunity to exit the PIP has to do with this final rolling period, and we will be reviewing in Bernalillo County next week, pending everything that's going on in our world right now. Very hopeful though. So some of the projections to see what's needed for getting out of item 2, unfortunately, this is an item we will not be able to meet. Currently, with the data for the last 5 months, we're at a 60.98. We need to be at 71.5, and we would have to have 16 strengths on this item in order to exit it, and we only review 12 cases. So there's just no way we're going to be meeting this item. And for item 5, there is a possibility that we can exit item 5. We will review 8 foster care cases, and if all 8 are rated as strengths during this review, we will exit item 5. So there is a possibility that we might be able to do that. So again, just that one more opportunity remaining. That remaining rolling period is from October 2019 to March of 2020. And that will be our Bernalillo site. And so that is what I have for you guys. Not sure if you have any questions.
So Angela, this is Leslie. I was wondering who sets the goals in the PIP? Are those set like jointly with the feds and CYFD, or how are those goals set?
So I was not the QA manager at that point in time when the goals were set back in 2015. But yes, it's my understanding that you know, those are set up by the Children's Bureau. And then we internally every year do come up with our own goals as well. And being that this is the final stages of the program improvement plan, you know, we want to prepare for the next one. So I'm really hoping that we will be setting our standards a bit higher between now and the next CFSR review. But yeah, so pretty much just kind of working together to see where we're at and where the rest of the states are at as well. It's my understanding that every single state was put on a PIP. And so we've all just been really working hard to try to exit that. Again, knowing a lot of those numbers are still low, I would definitely love to see us improve. And what I can say is, interesting enough, you know, we do go to the other counties that are not our program improvement plan sites, and we have definitely been seeing some really amazing numbers, especially in the safety and well-being areas. So I'm hopeful.
Good. I was just wondering, so do they look at things like kind of resources available? Like, do they say based on, you know, the resources you have for staffing and services available in the community and, you know, and that kind of stuff? I mean, do they look at all of that stuff, budgets and everything in setting those goals?
Yes, they do. And in fact, we only review the 18 items as part of the CFSR, but it actually extends to a lot more items to cover those systemic issues.
Okay.
So they do kind of, yeah, throughout the year, meet with stakeholders, really look at what's going on in the community and throughout the state, and really to kind of see where we need to be and where we need to put that funding.
Okay. Thank you. Somebody asked, Gail asked, are these results available online?
So I know that the initial CFSR from 2015 results are definitely online on the Children's Bureau website. And CYFD does put out, I believe it's the 360 report that does cover all of the data. So those are definitely available to the public. As far as the information in this presentation, it's kind of just what I've gathered from the different rolling periods that we've had. But I believe that we do have the data for all the counties as well accessible.
Okay.
This is Sarah. Can you guys hear me?
Yes.
Okay. I do believe that prior to round 4, at some point between round 3 and round 4, that they do publish pretty extensive information about all the state's different performances on as of the wrap up of CFSR round 3, and that's done through the feds as well. But as far as what we publish, the 360 report is going to be more data that I'm going to talk about a little bit after Angela's through here. But yes, it's always an open book. We're always happy to share the actual numbers with anybody who is interested in seeing that. And in fact, we are trying to do better at that.
I have a question. I would like to know, as Respondents Council, how do we help implement or increase CYFD to be meeting these PIP goals? Like, what are the actions that we can take that help to raise these numbers so that we have better outcomes for families across the board?
So I would definitely say that I see your program already assisting with the FAP program, because we do review in Sandoval County and have seen those improvements there. So I think, you know, just continuing to do that. As a respondents attorney, you know, I think one of the trends that we do see that's affected, like item 5 and 6, mostly 6, I would say, which is achieving that goal, is, you know, at times the feedback we get from the review is that parents are told that they really shouldn't work on any treatment objectives until that adjudication, which then already, you know, pushes that timeline back 60 days or more, depending on when the adjudication takes place. And so that's something that we've kind of seen be an issue. When we did meet with the Children's Bureau, I definitely would like to open up a training for you all in regards to how we review cases, what we look at. It's the peer reviewer training, and then also look at ways that we can assist in reviewing more of your cases, so we can kind of see what those trends and strengths and areas needing improvement are.
Thanks, Angela. And that was a great question, Nita. Appreciate it. Does anybody else have any questions for Angela?
So this is Nita again, and I just have another question kind of ongoing about the permanency goal, achieving the plan of permanency, PPLA, guardianship, etc. One of the things that I am seeing as a Respondents Council is that it seems like that there is a hesitation on part of CYFD, and it's certainly understandable. Even, you know, as Respondents Council, you feel somewhat of an obligation to not only zealously advocate advocate for your client, but also slow them down if they are acting prematurely, in the sense that you don't want to be advocating for a position that simply is unrealistic. But it seems like there's a lot of hesitancy to for on CYFD's part to change or implement like reunification at times, that they want to see this perfection in these families. And I think this is a good example of this is with substance abuse cases where, you know, we have this timeline of, let's say, a year, and we have someone who is really trying to deal with addiction. And some people, I think, have the ability to deal with that more successfully than others. You're going to have, you know, part of whether we like to see it or not, relapse is a part of recovery. And I think sometimes what happens is we'll be getting close to reunification. Oh, we've had a relapse. We gotta slow, stop everything, and then we gotta see all this, extra perfect improvement before we actually get to this goal of reunification. And so I am seeing that, and I think that is kind of unrealistic when the objective of these cases are the immediate safety that should be being addressed for families. And so, just because you have a substance abuse issue, are we expecting perfection in these families? We're holding them to this standard that is almost unrealistic. I think that's what I am seeing in some of these cases with reunification. Food for thought.
And so what I would say about that is that, CYFD has seen that. And I think with the new safety organized practice, it's definitely a shift for workers to see that, we're not necessarily looking for that perfection, but making sure that, children are safe. And a parent may relapse, but how do they learn to keep their child safe? Do they have a network? There's a lot more work that we are doing in regards to that as an agency.
Okay. Thank you, Angela. Anyone else, or are we ready to move on to Sarah? Anyone else? Okay. Well, thank you, Angela.
No problem.
All right, I'm gonna give this a shot. Let's see. Can everyone see a PowerPoint title slide?
Yes.
Thank you. Okay. So I'm going to talk, this is basically the other side of what CFSR looks at, or the Child, Family, and Services Review looks at when they are trying to assess a state's performance in the work they're doing with children and families. And these are the data indicators. Fun story is that for round 3, New Mexico is not beholden to any potential penalties based on these data indicators, which was not the original plan by the Children's Bureau. They had some significant issues coming up with the right way to calculate these, got a lot of feedback from the world of academia about the best way to do so. These are also very different from the CFSR round 2 data indicators. And it just goes to show that the federal government engages in continuous quality improvement as much as the states are asked to do. But these are still really, really important because they tell that bigger picture of how we are doing as a state as far as serving all children and all families that we come into contact with, whereas, quality assurance and those case reviews are really looking at a smaller sample. We do see a lot of alignment with the trends, with the areas we don't do so well in QA. We'll also see not as good performance in our larger data indicators, and vice versa. When we're doing better on items with QA, we'll see that reflected in the larger statewide data. But I like to think of QA as the qualitative data that really helps us understand the story behind the numbers. Whereas these data indicators are using administrative data straight from our system and are able to be aggregated to see the overall trends in terms of each and every family and child that we serve. The other thing I wanted to mention before I jump into what these are looking at is CFSR round 4 will likely have similar data indicators. Some of the ways those are calculated, again, might be revised and improved upon. The feds do what we call risk adjustment for each state. And so those help us compare ourselves to other states, whereas our non-risk adjusted numbers help us compare ourselves to ourselves. And just, all I mean by that is it's a little bit of a simpler calculation that allows us to compare county to county, and in a temporal way, we can see if we're making improvements or doing worse in certain areas over time. So I'm not going to get into the risk adjusted data today, just because it kind of requires a whole nother level of conversation. And there's special federal syntax that's used to calculate that, and that's what we're going to start using every quarter as we head into CFSR round 4. But essentially, the data or the casework that's being done now is going to factor into the data indicators that the feds look at for round 4. And we know that the pass we got on them not utilizing this data in terms of penalizing states financially, that is not going to be a luxury that we have in CFSR round 4. So I'm always trying to impress upon people that we need to be doing the good work now if we want to improve our numbers for 2021. Let's see, for some reason, it's not switching slides. There we go. Okay, so the first one that we look at, this coincides a little bit with item 2 that Angela described to everybody. This is going to be % of children who were victims of a substantiated maltreatment report during a 12-month period, who were victims of another substantiated maltreatment allegation within 12 months of their initial report. And so all of these measures are based on a rolling 12 months, which can be helpful in keeping the data fairly stable, but also any improvement or lack of improvement or downward turn in the data is going to take a much longer time to show up. But essentially, this is using a 12-month follow-up time frame and allows us to see whether we're taking the appropriate action when caregivers or parents are found to abuse or neglect kids, and whether our intervention is enabling them to keep their kids safe in the long term, or for at least that 12-month period. So the CFSR round 3 federal target for this was 9.1%, unfortunately, and we want this to be a lower number, of course. Unfortunately, we struggle with this one a little bit, and I will talk a little bit about why we think that is. We have a lot of complex factors that complicate our cases. You know, we have mental health issues, substance abuse being a really big one, domestic violence, housing issues. We know that in certain parts of the state, affordable and safe housing can be really hard for families to find. And while we may not take kids into foster care over some of those, like what we call sort of chronic low-level neglect, it can unfortunately lead to another substantiation within a year of that prior substantiation. Gaps in the needed safety-related services around the state, especially in certain rural areas, can be a huge factor here. Even if we don't have immediate safety concerns, there may not be appropriate safety-related services that we can refer families to without them getting frustrated by barriers or wait lists or that kind of thing. And we are trying to address that. Vacancy rates and worker turnover also does affect this. You know, obviously, finding the right services for families, doing those safety assessments timely and accurately, and really understanding the needs and strengths of a family requires some experience and really good training. And when we have counties with high vacancy or turnover, we just don't have as many staff that are able to make those more thorough assessments and get families the services they need. And Angela, I was going to say jump in at any time if I gloss over anything too quickly, if you have other thoughts. We do have a new safety assessment and a new service matrix that helps us and helps our workers make I think better assessments. It's been a massive culture shift for our agency to sort of take on this entirely new way of assessing safety and assessing the needs and strengths of families, as well as the vulnerabilities of children that are in the home. But our hope is that that will start to have an impact on this measure over the next year. Improvements in training is something we're also working on currently. And one of our PIP items was improving our linkages to providers with families, what we call warm handoffs. So not just handing a family a phone number, but actually having that worker facilitate a real, hopefully lasting connection between our families and service providers. And then we also have expanded contracts for secondary prevention services, such as in-home services, from 8 counties to 25 counties, and that was new for this fiscal year, 2020. And so that is a really big win for us and hopefully will alleviate some of those gaps in the service array. And just a note, this measure will also capture any repeat maltreatment for families who previously received high-level intervention, such as in-home services. You know, those cases are typically open for around a 6, maybe more period of time. And so this measure would capture any repeat maltreatment that occurred with those families that are higher risk. And so we're hoping that better treatment planning, whether that's a foster care case or an in-home services case, by using behaviorally based treatment plans rather than cookie cutter treatment plans, which has been an issue for us in the past, that we will get families into more meaningful services. Any questions about that? Okay, I'm going to move on. This next one is rate of maltreatment victimizations per 100,000 days in foster care. Again, this is going to use another rolling 12-month period to track incidents of maltreatment that occurs while children are in foster care. A note to remember is that it does include maltreatment perpetrated by relative and non-relative foster parents, of course, but also other caregivers such as respite providers and caregivers providing care to the child during visits and trial home visits. So it's any maltreatment that occurs while that child is in foster care. It used to be that this data indicator looked at the number of maltreatment incidents that were perpetrated by a foster parent. And understandably, that is not really looking at how careful we are about making sure that kids are safe, regardless of who's keeping an eye on them at that exact moment. We are responsible for the safety of kids in foster care, regardless of whether they're on a trial home visit, whether they're on a visit in the community with a parent or other caregiver. And so this expands that, the older definition quite a bit. And you can see that this is a rate we want to keep low. The target is 8.5, and we have struggled to maintain below that. And there are a few reasons for that. Obviously, we do have, unfortunately, incidents where children are found to be abused or neglected by a foster parent in a foster care episode. And one way that we, as an agency, try and ensure that safety is that substitute care investigations, which just means an investigation into any kind of foster provider, those get an elevated priority response. So what would normally be a priority 2 or priority 1 would be elevated up one level. So a P1 would be turned into an emergency. We do have a new safety assessment for these investigations just because we need to look at them a little bit differently and a little bit more closely. So the safety assessment is just a little bit different from if we're just going out on a first-time investigation for a family that's new to us. Something to bear in mind, though, that a relatively small number of incidents can impact this measure for a full year because it is a rolling 12-month measure. And that can be really devastating, especially to smaller counties. we do not track incident date when accepting and investigating reports. So what this means is that sometimes a child will come into foster care and a service provider or even a worker that works for CYFD will learn about a historical incident of abuse or neglect that occurred while that child was still with their biological family and call in a report. And there are many times where our statewide central intake will determine that that's worthy of investigation because it may be a brand new allegation. And we do have to go out and investigate and substantiate if that's warranted. But that does artificially drive up these numbers, especially since they're pretty low to begin with, just because we're not looking at the incident date, we're looking at the date that that report comes in and determining, or the system, I guess, is interpreting that as maltreatment that occurred during the foster care episode. And when we looked into this, it looked like about 20% of total incidents fell into that category, where the child was not maltreated by a foster parent or during their episode. It actually occurred prior to them being placed into foster care. We also see higher rates of this in counties where children leave foster care sooner, based on the fact that it's calculated per the total number of days all kids are spending in foster care. So counties that are really good at getting kids to permanency within shorter periods of time are going to also sort of artificially have this rate driven up, just based on how that's calculated. Sorry, I went really fast there. Any questions about that one?
Yeah, Sarah, we had a question from somebody. I think it was Alicia. Okay. Can you unmute, Alicia? Ask your question.
I can't see the chat. I don't know where it went, so.
Well, I don't think, she didn't put it in chat. She just raised her hand. We have this where she can raise her hand. I don't know if, I think if she's on the phone, I don't know if you're on the phone or computer, Alicia, but you should be able to unmute yourself. And I think if you're on the phone, Jen, is it *6?
Yeah, that's correct. If you're on the phone, *6 to unmute. And to mute back again after you're done.
So, Alicia, are you there?
I can take questions at the end too.
Okay. All right. Well, hold on to your question, Alicia, and we'll try to get back to you. You could also, Alicia, if you're not able to put something in chat, you could send me a text and I'll ask it. Okay. Okay. Go ahead, Sarah.
Okay. And then this is a big one and pretty relevant to the work you all are doing. This is showing our % of children in foster care for more than 8 days who achieve permanency within 12 months of entry into foster care. So this is really looking at the number of children, obviously, who achieve that permanency within 12 months of entry, again, based on a rolling 12-month cohort of kids entering foster care. This one's a little weird because it has what we call a companion measure that we're going to look at next that looks at those same kids and identifies who go on to re-enter foster care in the next 12 months. So it's looking at how well our state is able to balance the decision to get kids home within 12 months with how many of those kids maybe got sent home too soon. So you'll see we're not meeting our target here, which is 40.5. And there's a variety of reasons for that we'll talk about in a second. I'm gonna go on to the next slide just so we can start that conversation. Just to be clear, this is typically gonna be reunification cases because we don't usually get kids adopted within 12 months just because that's really difficult to do, except in really, really unusual circumstances. So it usually is reunification. It will sometimes be permanent guardianship. We're starting to be able to arrange for those after those kids have been placed, or a child has been placed with a relative for at least 6 months. So that can happen, and starting to a little bit more. But that's typically what we're looking at. But what makes it challenging, and I'm sure a lot of you are aware of this, is that families with kids who are placed in care have complex needs. It's really difficult to reunify within that time frame. And so if you have a family with substance abuse issues, again, housing issues can be really hard, especially if you have wait lists or barriers to the needed services. That is going to be really, really challenging. And I think based on a question that a respondent's attorney asked, Angela mentioned, you know, we really hope that respondents' attorneys don't encourage clients to hold off on engaging in services until adjudication, just because that's losing a lot of valuable time. And so that's a big one as far as this particular measure goes. I did want to mention that practice improvements, such as the program that you all are part of, are going to take a really long time to impact these data. The reason being is because it has that companion measure, it has to go back basically 2 years as far as identifying that entry cohort. And this will maybe make a little more sense when we look at the reentry measure, but that's just something to keep in mind, that we're basically going back a whole extra year as far as identifying the cohort of kids that we're looking at. But programs like NMFAP, things like improving our caseworker visits with parents are examples of things that we're trying to do to make an impact on this measure. So here's that companion measure I was mentioning. This is taking kids who are discharged from foster care to reunification, guardianship, or other relative placement within that 12 months. So that's a pretty, in New Mexico, unfortunately, that's a pretty small denominator. We're then following those kids for another 12 months to see how many of them reenter foster care. So the children in the numerator for the FY18 outcome entered foster care between July 1st and June 30th. Sorry, that's a typo. That should say denominator. They entered foster care all the way back in fiscal year 16, and they were discharged within 12 months and followed for another 12 months. So you can see how that data feels old, but it's really the only way we can track that longitudinal outcome for reentry for this particular measure. Does that make sense? I know that's a little bit of a head scratcher, but that's just kind of how we have to calculate that. Historically, we do relatively well on this measure. You'll see if I go back to that slide, we had a little bit of a spike in Q2 of FY20. That's going to equal about 30 kids. So if we have a few sibling groups that are all part of the same case and all of them re-enter, you know, that can spike up really, really dramatically over the course of 1 quarter, unfortunately. So we have done historically fairly well in that measure. Our denominator is small, as I mentioned, because we're not getting a whole ton of kids reunified within that 12 months. And so the few kids who do reenter are going to show up pretty dramatically in the data. And then similar to our maltreatment and foster care calculation, kids who are in the numerator stay there for 12 months. It is a rolling measure. The key here is that we need to ensure that we're not compromising stability or safety when we do strive to improve our 12-month reunification. Again, this is a balance that can be really, really tricky to achieve. Something that could potentially have a positive impact if we start seeing a concerning trend upward in this is just making sure that we're doing really frequent, high-quality home visits before and after trial home visits begin. And so if we do note that this is becoming an issue for our state and that the last quarter wasn't just a blip, that we need to maybe look at how we're conducting those visits, among other things, but that would jump out at me as something really important. So in a typical cohort, about a third re-enter within 3 months, another third re-enter by 6 months, and that remaining third reenter within 12 months. So it's a pretty even distribution in terms of how long it's taking for a new incident to cause that reentry into care. Should I just keep going and take questions at the end, unless anyone has any urgent questions? Okay, that's what I'm going to do. And then we have what we call our middle stayers. These are kids that are achieving permanency within 12 months of a rolling 12-month period, who were in care already for 12 to 23 months at the start of that period. So these are kids who are not getting that permanency within 12 months of entering foster care. But as far as that cohort is concerned, we're looking at how many of them go on to get it within the next 12 months. So again, we call them kind of middle stayers. They're not lingering in foster care as long as our long stayers, which we'll talk about in the next slide. But we are still obviously always going to keep working really hard to get those kids out of care. So typically these kids are going to be exiting to all different types of permanency, including reunification. Those are the kids that are getting permanency within the next like 1 to 5 months after that 12-month start. Adoptions will often fall into this category, and permanent guardianships as well. So this does make it challenging to target specific initiatives to improve these numbers. But with our overall numbers of children exiting within 12 months being so much lower than we want it to be, these numbers will look a little bit better, sort of artificially so, because we're missing the mark, that initial 12-month mark for so many kids. A lot of this is attributable to backlogs in the court system, such as termination of parental rights, and that sort of phenomenon of giving parents one last chance right after or right before changing the plan to adoption can have kids falling into this category. We're looking at trying to make sure that we're gaining and maintaining momentum on these cases, and they don't linger too long in the court system by doing these 90-day case staffings to figure out how do we really move this case forward. And some counties have seen some really nice improvement using that model. And then, of course, service array issues are also going to impact this. And I think that some of that is linked to that giving parents one last chance. If they did have a hard time getting services right away when their case first started, sometimes it takes them longer to engage, and we're giving them longer than what the federal guidelines would maybe suggest. And then we have finally our long stayers, and this is children in foster care for 2 years already at the beginning of a 12-month period. How many of them are achieving permanency within that 12 months? This is something we want to be a higher percentage, and you'll see, hooray, look, we're doing better than the 32% federal standard. That is sort of not really worthy of patting ourselves on the back, because the reason we do better than other states might on this is because too many of our kids are falling into that denominator at the beginning of a 12-month period. We are achieving permanency within that 12 months, but we have too many kids in the denominator. We should be getting kids permanency before the 24-month mark. Hopefully that makes sense. So what the Children's Bureau and the feds, aka the feds, sort of intend this to look at are these children who are traditionally considered difficult to place for adoption or other family settings, maybe guardianship. These are going to be kids that are high risk of aging out of the system, which also are typically hard to place for adoption. But as we do improve our other permanency timelines, we're probably going to get worse at this particular measure. Because again, the denominator will be made up almost exclusively of those really hard to place kids. And we're gonna struggle with that, I think. And then this is placement stability, which is a really, really important one. It's sort of in its own category as far as the amazing impact it can have on outcomes for kids. We know that it's linked to timely permanency. It's also linked to sort of less tangible things such as children having better education, health, behavioral health outcomes, connections to family and community. So this is basically looking at how good a job are we doing at making sure kids aren't moving around too much in foster care. This particular federal measure does look at just that first 12 months of placement because those tend to be the least stable. The target that we would love to reach is 4.12, and you'll see that this is one we've struggled with for a long time. And just in case anyone wanted to nerd out with me, this is calculated looking at every move that occurs per 1,000 days of foster care among the entire population within a 12-month period of time. It's a rate, so it doesn't tell you a whole lot unless you're comparing it to itself. So some of the things that impact this are going to be availability of foster families and beds, our ability to effectively match children in care to placements most able to meet their needs. I think that probably most of you are kind of aware of that. Our role of relative caregivers is huge here. We know relative placements, not surprisingly, are much more stable than non-relatives. And especially we can do a lot better with initial placements with those relatives rather than finding them later, finding them right away. Because if we place a kid with a non-relative and a week later find a relative willing to take that child, that's a move, unfortunately. And so even though we know that relative is in the best interest of that child, that's still going to be showing up in the data as a move. And so if we can reduce the number of those early on placements, especially with how we deal with relatives, I think it'll impact this quite a bit. We also do, unfortunately, have youth who run from foster placements or refuse to stay in foster placements, and those are going to translate to moves as well. And then every time we use congregate care, institutional, or shelter placements, those kids aren't going to stay there forever. We know that. So that's automatically an unstable placement. And so trying to minimize the use of those types of placements is a really great strategy to improve on this measure as well. We do, fortunately, have some good new contracts in place as of this fiscal year to specifically meet the needs of foster children and their foster placements, whether those are relative or non-relative. I think that those services were really lacking in a lot of areas of the state before, and that goes for non-relatives and relatives. We want to make sure that our relatives who are stepping up and willing to become temporary or permanent placements for our kids, that they're not overwhelmed, that they have what they need, they have the support, they can learn whatever skills are needed to meet the behavioral needs of these kids, medical needs, whatever the case may be. So we're really trying to improve what's out there for all types of foster families. And I think that's basically what I just was discussing. And I didn't make a nice slide that said questions on it like Angela did, but that's what it should say if anybody has any questions. I know I went through that quick.
So Sarah, I did have someone asked a question about the numbers for achieving permanency and the effect of appeals on those numbers and how, how those are accounted for. Because obviously,
Great. And Angela, if you have other insight, jump in. But if we meet our sort of bureaucratic legal timelines the way we should, that time period should not really be an impediment to getting kids to permanency in that.
Oh.
That makes sense.
Okay.
The issue is often we're not filing TPRs timely.
Right.
And so we're not even filing timely. Obviously that appeals process isn't going to come down the pike for a while.
Right.
So we're like we're missing those earlier timelines that are so important to kind of keep the ball rolling.
Right. Okay. Could I, sir, could I get you to stop screen share? Because that way I can see everybody better to see if there's any other questions.
Oh, sure. Yeah.
That's fine.
What do I do?
So go back down on that, on the bottom
Gotcha.
there.
Okay.
There we go. Great.
There we go.
Thank you.
Okay.
Um,
Sure.
So the other, another question that I had as you're going through this, when you're talking about the reentries, so one of the
Yeah.
issues that I've always had is that we pay all this money to support foster families. We put all these services in place for the family while the kids are in care. Then dismissal comes and parents are on their own. And so for the same reasons as you were talking about wanting to increase the services available for permanent guardians or adoptive parents or whatever to maintain that stability for those placements, is the department, I'm assuming that the department's looking at using some of that now, that 4E money that's being freed up, but are they going to be able to use that to help support families after reunification, after the case has been dismissed, to prevent reentry, to help prevent reentry?
You know, I think anytime we have a nice influx of cash, that's a great thing to consider. I think we can always improve, you know, the types of supports that we provide newly reunified families, especially for kind of that long haul. And I know that in terms of kind of I don't want to call it a culture shift, but something like we're starting to have a renewed emphasis on, especially with our new safety organized practice, is doing better at helping families really identify and utilize natural support networks. I think that's something that we have not been as good at in terms of how we intervene with families and how we work with them. And that's a huge part of safety organized practice, is really, really digging deep with families and figuring out, you know, because those natural supports are a lot more appealing to most parents than, you know, the agency in the middle of town, you know, that sees them once a week or once a month or whatever the case may be. The people that they can rely on long term to be there to help support them and their children, if we can make those links stronger, I think that can be really important to that as well. But I absolutely agree with you that there's some good secondary prevention that could maybe focus on those particular cases. And I'm happy to stress that to those that make those decisions here.
Thank you. Does anyone else have any questions? Don't see any hands raised. Any other questions? I don't think I've gotten any other sent to me. Let me make sure. Nope, I don't see anything else. I'm gonna guess about Alicia's question. It was something about the reporting of incidents of problems, incidents while children are in foster care, whether that incident happened like, you know, right then, or if it was something that, you know, happened before they came into care, but the department feels warrants another investigation of neglect on the part of the family. But then I think the question is also what happens with those referrals with foster parents. Like what if the allegation comes like after the kids leave foster care, or is that included in the numbers, or if it happened, you know, 6 months ago or in the first foster home, but nobody really knew about it. How do those get accounted for?
Those would definitely be investigated on some level. In terms of how that would feed into this particular data, it would actually just depend on when it was investigated and how that falls in that 12-month rolling period, which sounds like a weird technicality, but that's just the reality of how that data feeds in to that aggregate picture that we're painting here. But absolutely, if you know about a historical incident with a licensed provider, or obviously of anybody, the best thing to do is to call Sky. Don't worry about the flaws in our data system. We work those out. And that will be something that we're able to improve on when we get a new data system, which is coming in the next year or so.
Okay.
So
Thank
yeah,
you.
don't let that impede anyone's need to report, because it'll get handled. And obviously if anything occurred in a foster home, we would want to know about it.
Thank you. Looks like Nita, you have another question?
Yeah, I just, is there any definite procedure that should be being followed when reports are made on foster parents? Like, I don't know. My experience has been when, and don't get me wrong, like there are those parents, clients who really just don't help themselves, don't help their situation, are very kind of adversarial to foster parents, to the department, to their attorney. I mean, I get it, but I am talking about parents who have legitimate concerns about foster placements. I have seen them report to Sky, and it seems like their reports are getting just like they are not taken seriously, and they are, I guess, filtered out. They are not viewed as a priority. They are filtered out. And in one case, I kept telling my client, like, I'm sorry, I don't feel like there's anything I can do, because what's happening is she would report, and then it would create a more adversarial relationship with the department, where they would be telling the court, well, she's reporting, she's trying to interfere with the foster parent being able to do their job as a foster parent, and come to find out there was a dead kid in the home. So, like it was just a nightmare for my client as well as I, because it was like how she would report these incidents, and then what would happen is they would go, somehow investigations was giving that information to the PPW, and it was creating an even more like, and it was like kind of the PPW's call as to whether or not her report should be taken seriously. And I found that to be very concerning.
I find that to be concerning too. I mean, I definitely can't speak to a particular case, but I would say that if you have those concerns, you can always advocate for your client by maybe going up that chain of command and trying to speak with the county office manager, trying to speak with someone here in central office, the constituency person. If you really feel that that's how it was handled. I mean, it makes me sad to think it would be, but I don't know. I'm not in every office every day, so it's hard to know. But yeah, I would say.
So should it be going to the PPW? Should these reports, should these new allegations be going to permanency planning? Because my understanding is it was kind of like investigations is separate from permanency planning.
Yes, it is, although the permanency worker really is not the same as like the family's placement worker. So they wouldn't necessarily have that particular relationship with the foster placement. That PPW's job is to help that child's needs be met in the system. So if it was a conversation with the placement worker that was happening outside of an actual investigation, that would be one thing. But I think there's a little bit less conflict of interest between an investigator and a PPW.
I had a similar situation a long time ago. Well, it wasn't all that long ago, but I demanded by email of the county office manager there be an investigation. And according to the regs, that's not optional, but it did not happen. And I actually think there should be some sort of recourse spelled out. It was just really a disaster where the children were placed and they were practically adopted by these people. And in the end, they left the state, and it turns out everyone even acknowledged in the case that they had suffered very ill treatment in this foster home. So, and I don't know where this goes, except it's probably going to be a tort case at this point. But it really shouldn't have gone to that.
No, I would agree. And again, it's kind of challenging to talk about a lot of individual cases,
Yeah, it is.
particular settings. I mean, I crunch numbers, so I mean, I would say, you know, we always look to address any concerns with stakeholders, and you guys are certainly one of those groups. And it might be helpful to set up a meeting, you know, with the right people. I'd be happy to help facilitate that if there seems to be a pattern of concerns that you're noting. But yeah, it's hard to pick out these singular cases just because that's not what I do. But but I'm happy to put you in touch with the right people if that's something that you all have a concern about.
I think we
Thanks,
should
Sarah.
just probably establish an avenue, and and I really appreciate your listening. Thank you.
Yeah, no, I would agree. That sounds like an important avenue to establish, I would say. The other thing I wanted to let you all know is that the beautiful thing about these data indicators and this aggregate kind of quantitative stuff is that, excuse me, we can provide that by county. And sorry, I hate coughing these days. We can provide that by county if anyone's interested in comparing different counties or regions or judicial districts. Just reach out to me. I think that somewhere on some mailing list, my email address was there, but it's sarah.meadows2@state.nm.us. The organizers for this meeting have that info. I'm happy to create any kind of customized, you know, data assessment of a particular county or area if anyone is interested in that. Just because what I showed you today was all statewide, and I know that some of you work more in a more concentrated geographic area. So if you're interested, definitely let me know, and I can do my best to provide that.
That's great. Thank you, Sarah. So I don't want to keep everybody any longer. We're at 1:18 here. Thank you so much, Angela and Sarah. This was really great, very informative. We really appreciate you taking your time to share this information with us. Really appreciate it. For everybody else, just a reminder, please, and I put it up in the chat, and Jen put it up in the chat again, please fill out the survey for the post-session survey feedback. And also for our practitioners, please think about any cases or issues that you would like to present at our next group processing session. And other than that, I think we are done. Thanks again to Angela and Sarah. Okay, thank you, everybody.
Thank you all. It was really, really fun.
Thank you.
Thank you.
Thank you. Thank you.